We have two guests in studio that look absolutely beautiful, and it is such a personal pleasure to welcome Carm Tripp, the Executive Director of the South Coast Centers for Cancer Care, along with Kathy Tsonis, the Oncology Outreach Coordinator at South Coast Centers for Cancer Care. Good morning to both of you. Great to have you here. Carm, how are you doing?
Good. Thank you very much, Phil.
Nice to see you again. And Kathy, always a pleasure.
Good morning, Phil.
Good morning. We have so much to talk about. Folks, this is a real public service, and I think it's the role of a radio station in the community to do what you do, Kathy, and that is to do outreach in our community with great information. Carm, I want to start with you because there's something very special going on. First of all, tell us about the event itself.
All right. Next week we will be hosting a oral cancer screening event in the New Bedford area, and Kathy will go more into the details. Head and neck cancer is a term that's used to describe a number of different tumors that originate around the mouth, in the mouth.
Something that's
throat,
very obvious, too.
Correct. Throat, larynx, nose, sinuses, and the lips as well. And if these aren't caught early, they can be life-threatening.
Sure.
And that's why the screening is so important.
Wow. This is such a public service. I do want to get into some of the questions, but the screening is part of an awareness week, the Oral, Head, and Neck Cancer Awareness Week. That is April the 10th through the 16th, which is led by the Head and Neck Cancer Alliance, and it's supported by the American Academy of Head and Neck Surgeries and Surgeons, and we were really wanting to get this word out there, folks. Tell us a little bit more about inspecting the lips, the gums, the cheeks, the mouth. I mean, this is very important.
Absolutely. So some of the symptoms that we're looking for in oral cancer are any swelling, thickening, lumps, bumps, rough spots, crusts, or eroded areas on the lips, gums, or other areas inside the mouth. Patches that appear velvety white, red, or speckled inside the mouth. Any unexplained sore or bleeding, or a sore that doesn't resolve inside the mouth. An unexplained numbness or a loss of feeling, pain, tenderness in any area of the face, mouth, or neck. Persistent sores on the face, neck, or mouth that bleed easily and do not heal within 2 weeks. Yeah. A soreness or feeling that something is caught in the back of your throat. Difficulty chewing or swallowing, speaking, moving the jaw or the tongue. Hoarseness, a chronic sore throat that won't go away. A change in your voice, ear pain, a change in the way your teeth fit together or how your dentures fit, a dramatic weight loss. These are all symptoms of oral cancer.
Carm Tripp is joining us, the Executive Director of the South Coast Centers for Cancer Care, and Kathy Tsonis, who I want to turn to in a moment, the Oncology Outreach Coordinator at South Coast Centers for Cancer Care. Folks, there is a very important and absolutely free of charge head and neck cancer screening program going on with the South Coast Wellness Van this coming Tuesday. Mark it on your calendar, April the 12th, from noon to 5 p.m. at 114 MacArthur Drive in New Bedford. In a minute, I'll ask Kathy to tell us exactly what location that is, but this is very important. And also whether or not we need reservations for the screening and whatnot. Let me ask you that, Kathy. Do we need to phone in reservations?
Yes, it would be encouraged for everyone to call, and you can call 877-822-2732 to make an appointment. If you happen to be in the area and you have the time and like to stop in, it's perfectly fine to drop in, but we really encourage you to call for reservations.
Where exactly is 114 MacArthur Drive?
It is, the health van is going to be parked right in the Fisherman's Union Building, right on MacArthur Drive.
Sure.
You'll see it, it'll be close to Route 18, so it'll be visible.
Yep.
And you can come right on and see the nurses on the van.
And again, folks, this is Tuesday, this coming Tuesday, the 12th of April, from noon to 5 p.m. Absolutely free. And the screening is very, very important. Any prevention strategies, Carm, that you can give our listening audience?
Absolutely. According to the American Cancer Society, men face twice the risk of developing oral cancer as women, and men who are over 50 face the greatest risk. It's estimated that over 40,000 people this year in the United States will be diagnosed with oral cancer. Risk factors that we look at: smoking, cigarettes, cigar, pipe smokers are 6 times more likely than non-smokers to develop oral cancers. Smokeless tobacco users, dip, snuff, chewing tobacco products, are users of these products are 50 times more likely to develop cancers of the cheek, gums, and lining of the lips. Recent studies are showing excessive marijuana use also attributes to oral cancer. Excessive consumption of alcohol. Oral cancers occur 6 times more commonly in drinkers than in non-drinkers. A family history of cancer. Excessive sun exposure, especially at a young age, and that's why we recommend that people wear lip balm with SPF and sunscreen factors. The human papillovirus, otherwise known as HPV, certain strains of this can increase your risk factor for oral cancers, and that is why we have a vaccine, an HPV vaccine, that is usually given between the ages of 9 to 26 in young adults,
Right.
to prevent the occurrence of HPV. For older folks, limiting the number of sexual partners is a good preventative measure. And it's important to note as well that over 25% of all oral cancers occur in people who have never smoked or drank alcohol, or who have just drank alcohol occasionally.
Right.
So, what can we do to prevent oral cancer? Don't smoke or use tobacco products. Smoking cessation is really important. And even if it's overwhelming to think of quitting all at once, really, really think about cutting down your consumption of tobacco products. Eating a well-balanced diet is important. Limiting your exposure to the sun, and as I mentioned earlier, the use of lip balms with SPF factor, as well as it's just good practice for skin
Sure.
in general.
Yeah. Last year, folks, I was honored to be a part of a very special program that Kathy, you coordinated. It was absolutely so fabulous. As the outreach, the oncology outreach coordinator at South Coast Centers for Cancer Care, just touch upon what the purpose of that mission was, that meeting that night, that wonderful convocation. And then tell us a little bit about perhaps, the screenings that South Coast offers in the upcoming months.
Sure. Well, Phil is referring to our Shine a Light on Lung Cancer event that happens every November during Lung Cancer Month, and it really is an amazing event. We have the opportunity to celebrate with our lung cancer patients while we're sharing the message of lung cancer awareness and some risk factors. We bring all these events to our community to make it so that it's convenient for patients to come in and have a good time, but yet bringing awareness to the community. So these screening events are so important. They're free of charge, like our head and neck screening that's happening next week. Dr. Elizabeth Blanchard, one of our oncologists, she'll be on the van, along with a couple physician assistants from the South Coast ENT office, Joshua Frias and Melissa Corrett. They'll both be on the van. They'll be the ones that are actually doing the screenings. So I encourage people to attend.
And can I eat? Do I have to fast?
No,
Do I do
there
anything
is
special?
no requirements prior to the exam. Just come on. It's painless. They just use a light and look in your mouth, your throat. They look at your lips. examine the oral cavity, and it's pretty quick. Within 5 minutes, you're on and off the van.
Absolutely. Let me sum up things by having both of you give us your final thoughts. But Carm, screenings are so very important, obviously.
Absolutely. It's really important to have regular checkups with your doctor, your dentist. If you have an unexplained sore in your mouth, something that's not healing, do get it checked out right away. If you notice your dentures are not fitting properly, that's really important to get checked out, because ill-fitting dentures can trap food particles, bacteria, smoke particles in and around the gum area. So it's important to see your doctor for your regular visits, have an oral screening done, and dentists do this as part of their exams. So both of those, if you can't get out to the event, are your route of action to take.
Yes, fabulous job. Thanks, Carmen. Kathy, head and neck cancer screening is, as you say, painless, but so very important. Very, very important.
It is very important, and especially if you smoke, we encourage you to come out and visit, have a quick check, and follow up with your doctor if you have any of the symptoms or signs that Carm has mentioned today.
And early detection is key. Obviously, with early detection, we have better outcomes with treatments.
Sure.
So, early detection, folks.
And finally, I'm going to put you on the spot, Kathy. Have you saved anyone's life through what you do?
We have, I'm sure, saved quite a few lives, but there's one story in particular of a gentleman that came on the van a couple years ago, had a question of a lump that he felt, and came in. We got him into the cancer center within 24 hours. He was seeing everyone that he needed to see, and still to this day that man's smiling at us. So yes, we make a difference.
Oh, I love stories like that, folks. That's why I love both of you. Carm Tripp, Executive Director of the South Coast Centers for Cancer Care, and Kathy DeSonis, the Oncology Outreach Coordinator at South Coast Centers for Cancer Care. Anything else you'd like to include? Otherwise, we'll meet you Tuesday, April the 12th, noon to 5 at 114 MacArthur Drive in New Bedford. And you can call this number to make reservations, 877-822-2732. Thank you so much to both of you.
Thank you, Phil, for helping us get the message out.
Oh, it's a pleasure.
Thank you, Phil. Have
You're
a great day.
so welcome. Thank you, Carmen. Thank you so much, Kathy.